Hi, my name is Dr. Cha. I'm the medical director at San Joaquin Rehabilitation Hospital. What I'm trying to do is try to empower patient choices and in order to make these choices, I think it's important that the patient understands that the entire scope of hospitalization, whether you're in an institution to going home. And I have a diagram up here to kind of illustrate it, and hopefully we'll kind of grasp this entire global concept of healthcare in a very quick nutshell. So usually when we talk about when you have an acute event like getting sick and so forth, you usually enter the hospital, what we call a short-term acute care hospital or a NASTEC. And there they take care of your acute medical issues. Once that medical issue has gotten better or taken care of, now we have to determine where the patient would go. And these are usually the patient either goes home or to an outpatient setting or to other facilities in which we call post-acute care. And in the post-acute care, there are, depending upon the degree of need that you have, if you are in a ventilator and so forth, you can go to what we call an LTAC or a long-term acute care hospital. If you need acute rehab, you go to an IRF, what we call inpatient rehab, or a skilled nursing facility. So I work in an inpatient facility, rehab facility, so therefore I'm going to really talk about this more. The patient has to be matched to where they need to be to get the most gains. For example, if you are not on a vent and you need to get intense rehab, as you know, that the inpatient rehab is probably best for you. But given the fact that there are conditions here that we have to have, one, a diagnosis, because inpatient rehab requires specific diagnosis. Two, you must have rehab needs, at least two of the three, whether it's PT, OT, or speech therapy, and a place to be discharged to, like home or an assisted living. Where the average length of stay in the IRF is about 14 days or 10 to 14 days. Where now, if you're a patient that requires longer care and you can't tolerate intense therapy like 3 hours a day, you may be best suited for a skilled nursing facility. Now, you have to keep in mind that there's a lot of confusion out there. There's a huge difference between an inpatient rehab facility and a skilled nursing facility. Here, it is a hospital. You basically are seen by a rehab physician, and in many institutions, you also have internal medicine as well, and you see the patient on a day-to-day basis. Here, the physician doesn't have to see you on a day-to-day basis, and the intensity of therapy is about a lot less. Here, we do about 3 hours a day or 15 hours a week. Here, they do about an hour a day or 5 hours a week, and it's set up a little bit different. So if you need really intense therapy, inpatient rehabilitation facility is where you need to go. On a note, there are certain diagnoses that you need to be in an IRF. Like the most common one that we see is a stroke. And the reason for people with stroke needs to be in IRF is that they have to get therapy. They have to get intense therapy. So the level of intensity you need won't be offered anywhere else unless it's in an IRF. And that basically improves your outcome in the next 6 months. There has been studies that's been shown that people who comes to an IRF has better outcomes after 6 months after the acute event. And I think this comes from the concept of intense rehab. There has to be an intensity, very purposeful, and you're working with a whole broad spectrum of team from speech therapists, physical therapist, occupational therapist, your case manager, social worker, your physician, and nursing staff. And that's usually exists and it's built into inpatient rehab. So I hope that this video will be helpful for you or your loved ones when you see somebody sick. At least you have a broad picture on where that patient will be most suitable in to get the best outcome for you. And thank you.